My name is Dr. Yvonne Spurlock. I'm an internal medicine physician and I work for the Liberty Clinic. The patients I really enjoy treating are adults. Because I am board certified in internal medicine, I usually take care of the adult patient. But my favorite in that category would have to be the elderly. It's really amazing how much you learn from your patients, and I think the generation that's ahead of me, they know so much. They're so respectful. Their whole attitude about life is so different, and I just enjoy taking care of that group of people. A lot of times, I think they're the forgotten generation. I think their families are so busy doing their own thing, taking care of their younger children, that sometimes my patients in this generation felt ignored. And so it's kind of nice that when I see them, I feel like, they have somebody that they can come to at any time to share whatever ails them physically or emotionally, and hopefully I can help them out with that. I chose internal medicine because I grew up with a family of physicians. My father is an internist, so I grew up listening to stories, at the dinner table about how his patients were doing throughout the day. And when I was old enough, I was actually able to rotate with him and round with him and experience a lot of that firsthand. So it made quite an impression on me at a pretty young age. Thinking back, I really have one particular experience that I think really impacted on how I practice on a day-to-day basis. And it's not my own personal patient, but it was my personal experience. My father, who was a physician for a community, he took care of everybody, became sick, very sick. And he was sick for probably a decade, in and out of the hospital with pretty deathly, life-threatening illnesses, and there were several times that we felt that he wasn't going to make it through. And during these extended hospitalizations, I learned to play a different role. Rather than physician, I learned to be the patient's family member and to wait patiently for physicians to arrive to explain to the family what was going on with my father, who was so sick. And so seeing that and the anguish that these family members and the waiting that they have to go through, I try to remember that as a physician, that no matter how busy I get and how stressful my day is, that if a patient's family does call me, that I try to return that phone call as soon as I can, because I remember being on the other side and having to wait.